afternoon. My name is Sarah Gomes, and today I will be doing IV administration meds. For demonstration purposes, I'm doing it by my patient versus outside of the room like you would normally do. You are to make sure that you prepare one patient's medication at a time. You would check the medication against your MAR, making sure that the dosage is correct, making sure the medication is correct. You would also document the lot number and making sure the expiration date is correct. I would do my hand hygiene prior to touching the medication, then apply gloves for safety. Upon getting your medication, you would double check the actions, the special consideration, safe dosages, purpose, adverse effects, and you want to make sure you got the administration rate. Prior to this, I had done my dosage calculations. I'm administering 1 ml and at a rate of 1 minute and 1 to 2 minutes, so it roughly works out 6 seconds per line, so it's going to be a slow continuous push. So prior to this, I would get my syringe ready, get an alcohol pad, it's open for me, clean the top. While that is drying, I will uncap, not completely uncap my needle carefully, pull back against the plunger to make sure I'm at 1 ml of air, insert it into the top, putting the air in, invert the vial, making sure the bevel is below the fluid line, and making sure I pull back the plunger to get 1 ml. Flick the needle a little just to make sure you get all the air bubbles out. Carefully withdraw. You cannot recap the needle, but you can scoop, which that is what I'm going to do. Now that I've scooped, I can remove the needle and I would discard it in the Sharps container, and now I would be all set to administer medication to my patient. I would now enter the patient's room, change my gloves, perform hand hygiene, close the curtain for my patient's privacy, come in, ask my patient their name, their date of birth, check it against their bracelet, then check it against the medication order that I received along with the MAR, doing 3 checks. After I confirmed I have the right patient with the right medication, I would then proceed to check the site, the IV site, to make sure there is no phlebitis, nothing swollen, nothing red, everything looks fine. On top of that, I would also do a pre-assessment of the patient just in case if the medication has specific guidelines, if their blood pressure needs to be a certain rate or anything of that nature. I would also check with the patient to see if they have any allergies. If they have any allergies, I would make sure that this medication goes along with any of those situations to make sure that would be no adverse reaction. Now, I will take an alcohol pad and clean off the closest port. I will take the line and put it in. For demonstration purposes, I'm not going to push the plunger down because I don't want to add fluid to my mannequin at the moment, but I would slowly push down the plunger until I would get the rate that I need. But prior to pulling it down, I will pull back a little bit to see if I got any blood or anything in the tubing, as well as that I would want to make sure with my non-dominant hand secure the tube line to make sure you don't pull the IV out of the patient's arm. Once that's finished, you disconnect carefully. You still check on your patient, ask them how they're doing. Sir, how are you doing? Making sure they're fine and they took the medication okay. Once that's all set, I would discard this appropriately in the correct containers. I would also check my patient within 30 minutes, then periodically through the shift to make sure they still had no adverse reaction to the medication. Any excess medication, if it's a narcotic of any sort, I would make sure that I would have another nurse watch me discard the excess. And that concludes my video.